Hi, today I want to talk to you about different tests that I recommend for women who have thyroid conditions. My name is Dr. Lori Haley. I am a functional medicine practitioner. I help women to reverse their thyroid conditions naturally so that they can experience optimal health and get their lives back. I get a lot of questions about what tests women should have done when they are experiencing thyroid issues. And of course, there isn't one answer for everyone, but I'm going to tell you different tests that I commonly use in my practice with women who have thyroid conditions. So, first of all, you want to make sure that you get a full thyroid panel done. Most doctors will only typically test TSH and sometimes T4 levels, but you want to get a full thyroid panel. You want to be able to look at all of the thyroid hormones and also antibodies. It's really, really important to assess antibodies because about approximately 90% of women who have hypothyroidism have Hashimoto's. And if you do have Hashimoto's, then you're dealing with an autoimmune condition. So just taking thyroid hormone isn't going to do anything for the autoimmune condition. And what you have to do then is figure out why you are experiencing what caused the autoimmune condition so that you can take care of that problem. So another test that I recommend frequently is an adrenal stress test. A lot of women who have thyroid conditions also have adrenal issues, and it's important to address the adrenal issues. You want to look at cortisol levels, and you can assess that through an adrenal stress index. Cortisol levels are the stress hormones. They are released from the adrenal glands, which are small glands on top of your kidneys. And we want to look at how cortisol is being released throughout the day. It should be highest in the morning when you get up because that's what gets you up, gets you going, gets you out of bed. So we want to make sure that it's highest then, and then it should taper off as the day goes on so that it's lowest in the evening so that you're able to fall asleep. Many women have a lot of issues with their cortisol stress levels throughout the day. So that test helps us to get a good picture of what's going on with cortisol levels and helps us to be able to better manage cortisol levels. Another test that I recommend is a GI test. There are different ones, but they assess really what's going on with the gut. If you have leaky gut, of course, inflammation in the gut. If there are parasites or bacteria, they can also assess some viruses in the gut too. Gives us a really good idea of what's going on with the gut and to what degree we need to repair the gut. Another test I really like is a food sensitivity test. We can really help our clients with a food sensitivity test to build a customized meal plan and recipes. Once we work on the gut, we work on the liver, and then once we do that and we repair the gut, we don't want our clients going back to eating the foods that they're sensitive to. So the food sensitivity test gives us a great plan or a map to show us what they can and can't eat. So we really do like that test as well. And nutritional deficiencies is another great test, just to women who have thyroid conditions often have certain nutrient deficiencies for different reasons, and we can look to see what those could be and then really help them to get those nutrients through foods, supplements if needed, and doing that really helps to be able to reverse their thyroid condition too. So it's really about getting to the root cause of the problem, figuring out what that is, and testing really, really does help. And there are many, many other tests that we can do. Of course, we can do different hormone panels, and we can look for heavy metal toxicity and, just many others. But the ones that I talked about today are ones that I commonly use. So please like and share this video, and if you have any questions, please put them in the comments below or send me a private message. Thank you so much for watching.